In this video, I'm going to discuss some of the clinical issues and concerns that can arise when working with a client that is suffering from an alcohol-related disorder, and just some things that clinicians need to know. The first is the negative stigma that is attached to addiction of any kind in our society, and I mentioned that in the introduction video. But just wanted to touch on that again because it is important to be cognizant of that, because when we're dealing with clients and working with clients that suffer from addiction, we don't want them to feel judged by us as the counselor or therapist the way that they feel judged by society. So that's important, and just kind of counteracting that with person-centered skills, which is what I'm doing as part of my treatment plan. Another factor to consider is some of the difficulties that can arise when working with a client that suffers from alcohol-related disorders, and how that can really make the process of therapy challenging. Some of those are relapse, and that's very likely. Poor impulse control, emotional reactivity, lying to protect their addiction, and part of that potential dishonesty in that relationship can cause counselors to feel like they're being conned by their client all the time. But it's important to try not to go into the session thinking that way towards the client, because the client will sense that, and typically their reaction is one of anger and manipulation. And so it's important to really be aware of those possible difficulties, but to try not to let that affect your unconditional positive regard for the client. Another area that the counselor should be aware of is their own view of addiction and alcoholism specifically, and how that will affect their view of the client and their ability to work well with the client. Another factor to consider is the difference between addictions counseling and working with a client that suffers from addiction. If you advertise yourself as an addictions counselor, there's a specific licensure that is required for that, to be licensed as an addictions counselor. So be cognizant of that in the way that you advertise yourself. That's not to say that someone that's not an addictions counselor can't work with someone that suffers from an addiction. However, if you're advertising yourself as something that you're not licensed to be, then that's an ethical issue, and you're practicing outside of your scope of ability and knowledge. And so that's just important to be aware of that distinction. Also, the current criteria pertaining to substance use disorders in the DSM-5. If you're going to be working with a client that's dealing with alcohol abuse or use, then you need to be aware of those criteria for diagnosis. Also, be familiar with various 12-step programs and support groups that are available for people that suffer from alcohol addiction, and be able to link your client with those organizations and support groups and programs if there's a need to do so, and most likely the client will need that. They're very beneficial for people that are trying to remain clean and sober from alcohol use, and so being aware of those resources is crucial when working with a client like the one that I'm working with as part of this project. Also, knowing contact information for inpatient treatment facilities in your area or your surrounding area that other professionals that you trust would recommend. If you're working with a client that's suffering from alcohol use disorder and the individual therapy with you is not really working, and they've tried an AA program, 12-step program, and that's not really working for them either, then maybe it would be appropriate for you to recommend an inpatient facility to them, but you're going to have to know that information and know where to recommend them to go. And you're going to want to send them to a place that has been recommended and that is trusted by other professionals. So that's something to be aware of if you're working with a client with alcohol-related disorder. Moving on down the list, being aware of the likelihood that someone that is using alcohol may be using another substance. I know that in our substance abuse course this semester, we heard about how common it was for someone that was addicted to alcohol to use a substance like speed the next day to kind of pep them up and get them past that hangover so that they could function throughout the day. And so being aware that there's a likelihood that your client might be using other substances to counteract the effects of alcohol is important as well. Also, being aware of the physical signs of intoxication, like dilated pupils, discoordination, slurred speech, their rapid eye movements, random eye movements, things like that you're going to want to be aware of, so that if your client comes in and is exhibiting physical signs of intoxication but is telling you that they're sober, that you're aware of the discrepancy there, and that's going to be something that you're going to want to confront with them. Another consideration is multicultural. How do various cultures view addiction and alcoholism and alcohol in general, and how is that going to affect your client's view of their addiction or disorder? And also, how is that going to potentially affect their view of a possible diagnosis of an alcohol-related disorder? And so that's huge to consider, that multicultural piece when working with someone that's suffering from an alcohol-related disorder, how their cultural view of alcohol is going to play into the way that they see it themselves. And those are just several of the clinical issues and concerns that I feel in studying and researching this disorder are really important for clinicians to be aware of. And I hope, again, that by watching this, that it has been informative for you. And I thank you for listening.